Hello and welcome to my channel. In this video we will be looking at characteristics of OCD, depression, and phobias, which you need to know for AQA A-level psychology in the subtopic of psychopathology. I hope you enjoy this video and find it helpful. Let's get started. OCD, obsessive-compulsive disorder, is an anxiety disorder and is characterized by obsessions and/or compulsive behavior. Cognitive, perception, attention, thinking, characteristics. Obsessive thoughts are internal, persistent, recurring, unwanted and intrusive thoughts or beliefs, catastrophic thinking. Hypervigilance, selective attention, with sufferers having an increased awareness of source of obsession in new situations. Insight into irrationality of thoughts, behavior, with sufferers being aware that their behavior is irrational and not being resisted, but feeling unable to share with others their struggles, which creates a further issue of being able to control them consciously, causing further anxiety. Cognitive strategies to deal with obsessions, with sufferers adopting certain strategies to help them manage their extreme irrational anxieties, which causes them to appear abnormal to others, e.g. someone who suffers from extreme guilt may pray regularly. Behavioral, ACT, characteristics. Compulsions, external components, are repeating behaviors or acts. They are repetitive, with suffered feeling compelled to repeat behaviors that are observable, e.g. hand washing, counting, tidying, ordering. They also reduce anxiety, with sufferers performing these actions in an attempt to reduce their fear of something dreadful happening if they don't repeat these behaviors. Avoidance, with sufferers keeping away from situations which trigger an anxiety response. Social impairment, with sufferers struggling to be around people and finding it difficult to conduct social interpersonal relationships. Emotional, feel, characteristics. Anxiety and distress, with sufferers experiencing an overwhelming amount of anxiety response to certain triggers of their unpleasant and frightening thoughts and beliefs, with their urges to repeat a behavior creating further anxiety. Depression, with sufferers experiencing low mood and a lack of enjoyment in activities. Guilt and disgust, with sufferers having irrational guilt, feeling high levels of shame or embarrassment and disgust directed at something external like dirt or the self. Depression is a mood disorder characterized by a chronic low mood and low energy levels. It is diagnosed using the DSM-IV is that at least 5 or more symptoms of depression should be apparent. Cognitive characteristics. Negative schemas, with sufferers paying a significant amount of attention to negative aspects of a situation and ignoring the positives. Sufferers also expect things to go badly, which becomes self-fulfilling due to lack of effort and motivation, which further reinforces their depressive thought patterns. Cognitive distortions, with sufferers interpreting all situations in a negative and biased manner and being more inclined to have a bias towards recalling unhappy events rather than happy ones. Diminished ability to think or concentration, with sufferers finding themselves unable to stick with a task that they would usually or make decisions which they would usually find straightforward. Absolutist thinking, black and white thinking, with sufferers viewing an unfortunate situation as an absolute disaster. Suicidal and death thoughts, with sufferers having persistent thoughts about their life ending and then not being alive. Irrational negative thoughts, with sufferers having exaggerated or delusional negative thoughts about what people think of them, themselves, the world, and the future. Behavioral characteristics. Change in activity levels, reduced energy levels, increased lethargy and fatigue, which causes an individual to withdraw from activities such as work, education, and social life, and in extreme cases causes the inability to get out of bed and neglect to personal hygiene, less washing, wearing clean clothes. Increased activity levels, psychomotor agitation, which causes individuals to struggle to relax. Behaviors shown include individuals pacing up and down their room. Disruption to sleep may be reduced. Insomnia, e.g. prematurely waking up or sleep, may be increased. Hypersomnia, e.g. oversleeping. Disruption to appetite. Eating may increase or decrease, causing weight gain, obesity, or weight loss, anorexia. Aggressive acts. Sufferers are often irritable and can become verbally or physically aggressive towards others or oneself, e.g. self-harm, suicide attempts. Reduced movement and speech, with sufferers not engaging in activities which they used to enjoy and not attending events which they used to be a part. Sufferers often rarely leave the house and when in the presence of others engage in minimal conversation. Social isolation, with sufferers withdrawing themselves from all social activities and seeing other people as little as possible. Sufferers will stop seeing friends and family and try to completely isolate themselves, with sufferers further struggling to maintain any form of interpersonal relationship. Emotional characteristics. Lowered mood, with sufferers feeling worthless, a lack of enthusiasm and emptiness, as well as persistent feelings of sadness and hopelessness. This low mood may come and go in cycles lasting months or years. Anger, with sufferers experiencing high levels of anger towards oneself or others. Lowered self-esteem, with sufferers self-loathing, hating themselves, and feeling as though they have a lack of control over their lives. Guilt, with sufferers experiencing excessive guilt or self-blame in situations that more than likely aren't their fault. A phobia is an anxiety disorder and involves an intense, irrational fear of a specific object, situation, or activity that leads to avoidance behavior. Cognitive characteristics. Catastrophic thinking, with sufferers often anticipate the worst possible outcomes in a given situation, believing that something terrible will happen if they encounter their phobic stimulus. These thoughts are irrational in nature and resistant to rational perspectives offered. Selective attention, with sufferers focuses excessively on the feared object or situation, often ignoring other relevant information that contradicts their fear. Overestimation of danger, with sufferers overestimating the likelihood and severity of danger associated with the phobic stimulus, leading to heightened anxiety and avoidance behaviors. Awareness of irrationality, with sufferers being able to recognize that their fear is irrational, unreasonable, or excessive, which helps distinguish them from having a mental disorder. Negative self-talk, with sufferers engaging in negative self-talk, convincing themselves that they are incapable of handling the situation or that they will embarrass themselves if they confront their fear. Behavioral characteristics. Panic, with sufferers exhibiting behaviors such as crying, running, screaming, freezing, fainting, collapsing and vomiting in the presence of their phobic stimulus. Endurance, with sufferers remaining in the presence of their phobic stimulus, often freezing and staying still. Avoidance, with sufferers often going to great lengths to avoid the object or situation that triggers their fear. This can significantly limit their daily activities and social interactions. Safety behaviors, with sufferers adopting specific rituals or behaviors to feel safer when they cannot avoid the phobic situation. For example, someone with a fear of flying might carry certain objects or engage in calming techniques. Emotional characteristics. Anxiety, with sufferers feeling worried and distressed in the presence of or in the perceived presence of their phobic stimulus, as a person may constantly worry about encountering their fear. Irrational, persistent and excessive fear, with sufferers feeling terrified, overwhelmed and scared when confronted with the phobic stimulus, which can be disproportionate to the actual threat posed. Panic attacks, exposure to the phobic object or situation can trigger panic attacks, leading to feelings of terror, helplessness, and a sense of impending doom. Thank you for watching. If you have enjoyed this video, please like and subscribe for more content like this. Bye.